Tim, when Tim was playing with his friends when he was younger, had a little bit of a mishap, and well, you just let's call it a mishap.
Yeah, well, it was.
It was an accident.
Yeah, we were playing, and I was strangled, and one way or another, they got me down from the situation I was in, and I was taken to the hospital, had emergency tracheotomy, and I was actually pronounced dead on arrival at one hospital, and it was a weekend. My father was playing outside with a doctor, and he said, well, let's take him down to the next hospital, which was the Cleveland Clinic, and they kick-started me there, I guess, and I woke up on the 11th day, so I was in a coma for 10 days. So.
Okay, so it was a bunch of kids playing and put it around the neck.
Ropes, cowboys, Indians, whatever it was.
Cowboy and Indians, just normal everyday kid stuff that I'm sure most people are still doing. Obviously, during what had happened, the head was pulled off the neck pretty severely, would be a safe thing to say.
You think?
Yeah. Well, it's a good thing you're not this heavy now that, that's pretty low. Well, as a young person at 5 years old, I don't think the body weight was strong enough to actually, well, maybe it was. Very close, let's just say that. So, the history of your structural health after that incident, when did you start noticing like discomfort and things like that? How old were you?
Early 20s mostly.
Early 20s?
Yeah, after I stopped growing.
And that started in the back?
Lower back, yeah.
In the lower back?
Right.
Did you ever have neck problems or anything like that?
The usual stuff, cracking my neck all the time, that stuff. And,
but most of the discomfort was in the lower back?
Yeah.
Okay. So, and that progressed until...
Discectomy, laminectomy.
How old were you when you had that?
25 when I had the first procedure, and then, I don't know, 6 or 7 years later, I had to have anterior and posterior fusion on 3 levels in my lower back, and when I was healing up from that, I ruptured C6 and 7 in my neck, and then I had part of my hip taken out for that one. So.
Okay.
So it's been a grand time since then.
Let me ask you though, but did you have any trauma to your spine after the incident? No incident where you went off a jump skiing, landed and ruptured your disc?
No.
This was a slow progression of
yes.
discomfort, and then at 25 you end up having...
Yeah, it started out like chiropractors and getting straight. I used to run, and that would cramp me all up. And
the manipulation of the neck with chiropractic, is that what you were doing?
Right, and my back. Yeah.
And the back. And how was that treatment going?
Well, it would straighten me out on a short-term basis.
Okay. Now, I remember you had talked about traction. And how much traction have you had?
People over time recommended different things, neck traction with a thing over the door, a bag of water or whatever. When I was in for one of my lower back surgeries, I had my leg in traction for a while, and all sorts of different. It was basically spin the dial. See what works.
Whatever is helping. But to me, it's fascinating that here you were in this situation of having the accident, which you were hanged, and then all of a sudden they want to continue that process by trying to pull more. So that's kind of an interesting idea.
No, it starts with like neuralgia on below my right ear and goes into my shoulder, and then I start to twist, and then my hips go out, and then by then usually I get a muscle spasm in my lumbar region, and by then it's pretty much done. I have to stop whatever I'm doing for a while, and go to drugs, go to ice, go to therapy, whatever. So it's kind of been a cycle I just try to live with, but do the best you can. I've tried almost everything. Trigger point injections, osteopathy.
How did the back surgery do for you? Did it alleviate all that?
No.
Huh?
No, not at all.
When you get an adjustment to your atlas, what do you feel?
More than anything, taller, like my skeleton's hanging off a center, like a plumb bob.
Right. And the idea of when you're in adjustment, how are you feeling now?
When I'm in adjustment or
When
right
you're
now?
No, not right now.
I can use a
'cause I know
tune-up.
you're out. When you're in adjustment versus when you're out of adjustment, how do you feel?
You know, taller, straighter, my chest is more open.
Pain-wise?
Yeah, I don't have that kind of chronic headache and it alleviates a lot of lower back problems.
Right. When I adjust him, one of the big things that happens is he gets a release in his feet
Right.
and
My ankles.
your ankles.
Yeah.
And that tells me how much tension he had in his spinal cord all the way down. All his muscles get so tight, even his ankles are tight. So the interesting thing is to adjust the atlas and all of a sudden feel the release of the muscular tension in the ankles. And, you know, for me, I can watch you from behind, and when you get in an adjustment, you can feel and watch the head start to move up right away.
Right.
Yeah.
Well, the experience is pretty weird, you know, so because you don't notice it right away. It's so, but then gradually you start to feel different things, like blood flowing in areas that haven't flowed, you know, and there are different sensations that you've had, or I've had in the past. So it was just kind of strange, and then you lay down and rest and do it again and everything. But like I said, when I walked out, I was taller and my shoulders were more open, and you know, I was upright for the first time in a long, long time. So, you know, that was at least a short-term benefit.
Let's say in 1961, after all the acute emergency things were taken care of, for someone to say, you know what, he had a trauma pulling his head off his neck, maybe it's a good idea that we should put his head back on top of his neck. And I do believe that would have solved a lot of your problems, obviously, but, you know, the concept is there's not enough people that are aware of the severity of kids playing around with each other, pulling on each other's hair, pulling on each other's heads, pillow fights, sleeping positions of kids in cars with their head hanging off of their neck. All of this does affect the spine. And I just wish there was someone that could have adjusted your atlas a long time ago, and it would have saved you a lot of discomfort. You know, one other thing that I want to go into, it's always amazing, and I think that it's a big thing when patients have this significant of an injury, the first time you leave the office, walking down the street. What was that like?
It was great.
Yeah.
Yeah.
Because
You know the difference if you've been through a little bit of this.
and it's more, and it is an experience thing.
Yeah.
You know, like if someone said, now you've been operated on, you've been injected, you've had every treatment you could possibly imagine. If someone said to you, Tim, go see this guy, he's going to do nothing to you, or he's going to put a little tiny instrument that you're not going to feel, and he's going to straighten you out.
Right.
I mean, that itself is
I was a
really-
skeptic, let's put it that way.
Of course a skeptic, but it's great. It's great, and I can imagine someone that had all these significant injuries being able to walk out and saying, hey man, this thing is doing something. We don't know what it's going to do ultimately, but you know, that original shifting of the head and having your spine shift. I mean, you couldn't pick a better candidate to have their atlas adjusted than someone who was hanged and having the atlas displacement, and then grow up having all of this discomfort and pain and surgeries and all of this business. But you know what? It's working out, and that's it.
That's it.